Nash to the Minister of Health, the need to assist with the costs of treatment and associated costs for children with neuroblastoma.
Thank you very much, Ceann Comhairle. Thank the Minister for being in the chamber to address these concerns today. Baby Alice Turner from Drogheda, Clodagh Daly from Laois, Robin Smith from Dublin, Merrin Lacey from Bray, Donald Parsons from Sligo, all young children, just infants, and each of them are affected by the condition known as neuroblastoma. For most Irish people, Ceann Comhairle, the first time they will have heard mention of this dreadful illness was when Lily May Morrison, the tiny dancer from Galway, and her family captured everybody's hearts last year and the year before to raise awareness and indeed funds for her treatment for neuroblastoma in the USA, and I'm happy to report that she is doing well. Thanks to the tenacity and the determination of her family and indeed friends and supporters right across the country, she got the kind of treatment that is currently needed by at least 6, but possibly 10 to 11 Irish children with the same condition. The families who are currently affected by this often extremely aggressive childhood cancer are very grateful indeed for the expert care and for the commitment shown by medical staff here in Ireland in the context of the treatment that they receive here. This is not an issue, and I want to be clear on that. The treatment is excellent, the support is excellent, and I want to place that in the record of the House on behalf of the families affected. But, Minister, as you know, a seriously sick child is every parent's, indeed every family's worst nightmare. Our own hearts, I think, it would be fair to say, sink when we hear of a child diagnosed with any serious life-threatening condition of any description. But when the diagnosis is neuroblastoma, then this, I think, presents a whole new set of challenges for the family affected. It is, of course, the natural order of things when we say that a parent will do anything in their power to give their children a shot at life. And when I say anything in terms of treating neuroblastoma, this anything also means having to raise up to $200,000 to meet the cost of getting onto a program in the US which has a proven success rate and which means minimising the often catastrophic risk of relapse. Relapse rates are extremely high. It can be 70 to 80% in cases where the aggressive form of the condition is present. There are, though, strong reports from the US in terms of the efficacy of this program and this type of treatment. Minister, I don't have the answers to all of these challenges for the families who are living with this waking nightmare of neuroblastoma. If only I had, and I don't expect you to have the answers here this afternoon either, but I will make this appeal to you today. I think there has to be a better and a more humane and a more supportive way that we can find as a state to assist these families in some way to make sure that they spend as much of the precious time that they have available with their children or with their families, and not going from cake sale to coffee morning or from fundraising gig to table quiz to make sure that their children get the chance that every child deserves.
Thank you, Deputy Minister.
Thank you, Ceann Comhairle. I welcome the opportunity today to speak about the issue of neuroblastoma and to respond to Deputy Nash's topical issue debate. Neuroblastoma is a disease in which malignant cancer cells form in nerve tissue such as adrenal gland, neck, chest or spinal cord. Neuroblastoma most often begins during early childhood, usually in children younger than 5 years of age. Proven treatment regimens for children with neuroblastoma are currently provided at Our Lady's Hospital for Sick Children in Crumlin, which is a centre for paediatric oncology services. Treatment for neuroblastoma involves a number of diagnostic and treatment approaches, which include surgery, chemotherapy and radiotherapy. Under the Treatment Abroad scheme, the Health Service Executive provides the cost of approved treatments in another EU EEA member state or Switzerland. The application to refer a patient abroad must be assessed and a determination given before that patient goes abroad. To qualify for the Treatment Abroad scheme, the treatment must be medically necessary to meet the patient's needs. In addition, it must be a proven form of medical treatment that is not as experimental. Ireland has focused on improving the quality of cancer services through reorganisation and expansion. The overall approach is set out in the Strategy for Cancer Control. Huge improvements have been made in cancer diagnosis and treatment. We've moved from a fragmented system of care to one that consolidates cancer treatment with multidisciplinary care and decision-making. Survival rates for all cancers are now rising. The 5-year survival rate has increased to 56.4% for people diagnosed between 2003 and 2007. It was 49.6% for people diagnosed between 1998 and 2002. The full impact of the reforms in cancer care should, in time, further improve our survival rates. I very much acknowledge that parents of children who have been diagnosed with neuroblastoma or any other serious illness will be concerned that their children receive the best possible care and treatment. I am informed and assured by the HSE that Our Lady's Hospital for Sick Children in Crumlin provides proven treatment regimens for children with neuroblastoma. There is, they indicated the treatment that's provided in Crumlin is of a world-class standard. We treat children there on the European Neuroblastoma Protocol, which incorporates all modern available therapies. There is indeed no other recognised proven treatment available anywhere in the world. And I'm informed that in Our Lady's Children's Hospital, that in the last year, a new phase 2 trial has been opened, and that the hospital and the staff there and the experts are very proactive in this field and operate in a structured and ethical way. So I do thank Deputy Nash for raising this issue here. It's obviously one in which there are developments, ongoing developments, which are very welcome, but anything that we can do in order to assist and support the parents and families of young children with neuroblastoma, we certainly would wish to do so.
Deputy Nash.
Thank you very much, Minister. The reason I raise this is because I've seen the direct impact on two families I know very well, one in Drogheda and one in Galway, the Turner and Bowen families in Drogheda, and the Morrison and Hayes family, Lily May's family in Galway. And I certainly know that the way in which the community in Drogheda has responded and the way in which communities right across the country have responded to these issues has been truly phenomenal. The fundraising activities have been exceptional, there's no doubt about that. And you're quite correct in what you say, that the treatment regimen and the staff who are providing the treatment in Crumlin are absolutely fantastic, and are a credit to that hospital and a credit to the health service. But I raise the issue here today because I get the distinct sense as well that diagnoses of this condition are on the rise. And I think it's legitimate then to ask questions about the way in which the state would address neuroblastoma going forward. And I think if indeed it is becoming more prevalent and more of an issue, then I think it follows then that from the point of view of the requirement to raise funds, that's going to become particularly challenging over the next few years, and I think necessitates a comprehensive response and a comprehensive strategy and plan from the HSE and the Department of Health in terms of providing newly evolving treatments for neuroblastoma here and indeed right across the European Union. I know the Minister will be aware and the Department will be aware of the types of treatments that are currently available in the US. Many of them are by definition of a trial nature. However, the efficacy, I think at this stage, has been well proven. In fact, there are cases that have been drawn to my attention where there have been 100% success rates in terms of dealing with any recurrence or relapse. So I think it's important that we note that and that the HSE and the Department of Health are conscious of the need to bring forward some kind of strategy and support mechanisms for families who are compelled now to raise significant funds to ensure that their children get the best chance possible at life.
Thank you.
Don't have too much to add to what I've already said in relation to this, Count Carlow, other than again to welcome Deputy Nash is raising this important matter here in the House this evening. I think he's right in relation to the improvements that are in place now in relation to diagnosis. The survival rates have improved considerably. We are, as a country, focused on improving the quality of cancer services, as I've indicated already, through reorganisation and expansion. We have previously had a very fragmented system. We now have one that consolidates cancer treatment in eight designated cancer centres, not including Crumlin, but with multidisciplinary care and decision-making. I suppose the full impact of the establishment of the National Cancer Control Programme and the introduction of cancer screening programmes will not be realised until we are evaluating 5-year mortality for patients diagnosed from 2012 onwards, given the time required to achieve full national rollout and rapid access clinics in designated centres. So this is an area that is, I mean, there are enormous improvements, great opportunities, huge potential, but that they bring with them the kinds of challenges that Deputy Nash has outlined so clearly in the course of this discussion. So certainly we will do everything we can, as I've said already, to assist families, and the principal focus though is to ensure that we have cancer services, both in terms of diagnosis and treatment at the highest possible standard, international standard, and also to ensure that we have all the best supports in place for families affected.
Thank you. Thank you. The fourth and final item is from Deputy Owen Murphy to the Minister for Education.